Episiotomies, epidurals, and exercise. What do they all have in common? Well, I'm going to tell you. We'll do a little lowdown on each. So to start with, episiotomies, let's talk about those. You really don't want one unless you absolutely have to. It's a little old school. It used to be like, baby's ready to come out, let's just slice mom and baby comes out easier. They used to say that when you would cut the perineum that it would actually heal back more easily and you're less likely to tear farther. Well, that has since changed, so this is something I highly recommend you absolutely talk to with your doctor. It is still, there are some instances when episiotomies are definitely needed, but for the most part you can avoid episiotomies by staying strong. Kegels definitely could help you decrease your chances of having to have an episiotomy because you're just stronger down there. There's more elasticities to those muscles when you're working them. Plus, perineal stretching, absolutely cannot recommend that enough. And I don't know so much about doing it before you go into labor and delivery, but definitely during delivery. I know that I've read enough on that to know that that's when it's most beneficial. And so perineal stretching is when the baby's head is crowning and either the doctor or nurse, is going to get some sort of lubricant to help work your perineum, and so that way it's lubricated up, and then as baby's head comes out, the skin and the muscles are more likely to stretch. And if you tear, hopefully you only get a little bit of natural tearing, which is going to heal up a lot easier than having to be cut. And so this is where, if you watch my other video, I talk about how my doctor had me push the baby out more gently. Then you're not just forcing baby's shoulders out and everything to stretch more than really needed. So that's something, especially with your first baby, when nothing's been opened up yet and it's the first time, highly, highly recommend you talk to your doctor about, the episiotomies and, say I'd rather avoid one if possible, so she knows that you guys are on the same page, because every doctor is different in their practices and what they think is good and not good, and if they have a different suggestion, at least hear them out. And if you're at the very beginning of your pregnancy and you're going to different doctors and maybe you guys don't see eye to eye, maybe it's a good sign that you need to find a different doctor. And so those are just some little tips on that. Now, epidurals, is to help with the pain, and there are definitely risks to having epidurals, like any sort of medical procedure. So, but if you're terrified of the pain, or you're just not sure about trying to learn any natural methods, I highly would recommend them. But again, talk to your doctor. There are other things you can do to help with pain, like hypnobabies, learning like different methods to really help with your breathing and relaxing. Because when it comes to really pushing baby out and letting baby descend down deep into the birth canal, it really comes down to you relaxing. But if you have to give in and have an epidural, it's not the end of the world. You'd rather be able to have baby descend down into the birth canal and be able to push baby out than go have a C-section, unless, of course, that's your choice. But your recovery is going to be a lot harder with a C-section. Plus, you have to deal with the scarring, and I've worked with a lot of moms right after baby, all the way up to like moms, that have 30-year-olds, and I can tell you moms that have had C-sections have a much harder time trying to reactivate those deep core lower abdominal muscles. So I highly advise against it. There are instances, obviously, you have to have it, and so you can work with that. There's nothing wrong with it, but definitely keeping C-sections towards an emergency. That's what they were designed for, and definitely doing a natural birth or planning on an epidural is definitely going to be your best and healthiest route. And plus, it's really good for baby to descend through the birth canal to get all those natural immunities and everything that baby needs. That's what our bodies were meant to do. And then where does exercise fall into the labor portion of this? And that is, I know you're going to know, it's doing your Kegels, which it's not just Kegels, it's Kegels, hugging your baby, working your entire deep core, because by having that groundwork laid, you are going to be so much stronger and more efficient at being able to push your baby out, even if you have an epidural. I always tell my girls, now you got to give yourself a little bit of time to, find those muscles. So that's normal to okay, you have the epidural, you're like, I don't really feel anything. But once you really activate those muscles, because it's muscle memory that's kicking in, hopefully you have a much greater chances of pushing your baby out, more quickly, less complications, because you're really stronger, that you don't have to, push for hours. Because my girls I work with, myself included, literally it's like minutes for a lot that you're able to push baby out and you're good to go. Plus, all of that can help you, get your body back quicker. So there you have it, episiotomies, epidurals, and exercise.